Hello, viewers, and today I am back with a new topic that is trigeminal neuralgia. And today I want to discuss the common symptoms of this condition, how we can diagnose this condition, and what are the various options for treatment. So let me share my screen first. So I think now you are able to see my screen. That is, and the topic, as I mentioned, is trigeminal neuralgia. And so, as always, what is this condition? So, this is a condition where patients who have this condition they experience severe facial pain, and the pain is usually on one side. So, one side of the face is affected, and more commonly, right side is more affected than the left side. If you look at the divisions of the nerve that can be affected, the maxillary and mandibular, the lower, the middle one third and the lower one third are affected more. Upper one third can be affected, but it's only in about 5% of cases. Patients usually describe a very severe, sharp, shooting kind of pain, lancinating type of pain, and the pain lasts for few seconds up to 2 minutes. So the pain of trigeminal neuralgia does not go beyond 2 minutes. If someone has pain lasting for more than 2 minutes, we should think of alternative diagnosis. Frequency is variable. Some patients can have very, very infrequent attacks, but sometimes the pain attacks can be multiple times every hour. So this can vary. But the typical finding is that in between two episodes of pain, the persons are totally pain free. But they're always worried about the next episode of pain. So they may be anxious, but pain is lacking. And how about localization of pain? So patients, if you ask them, they can precisely localize their pain. In about two-thirds or 60% of patients, the pain radiates from corner of mouth or angle of jaw. In about 30%, it radiates from the upper lip or the canine teeth to eye or the eyebrow. But the orbit as such is spared. So it's only on the side. What are the triggers of pain? So pain in terminal neuralgia can be triggered with various activities of the face, like such as chewing food, eating food, swallowing food, or even smiling can trigger pain in many patients. And activity of daily living, such as washing the face with water, brushing the teeth, shaving, all these, or even simply touching the face also can trigger the pain. And some people, when they have severe terminal neuralgia, any blow of air on the face by fan, ceiling fan, or table fan, or AC, or when they travel and windows are down, then the breeze coming from outside, all of them can also trigger the pain. And sometimes when they drink liquids, either hot or cold, that can also trigger pain. So you can, as you can imagine, there are so many triggers that the daily life can be crippled or handicapped in patient with terminal neuralgia. So, what are diagnostic clues? So, some things in the history can help us in diagnosing. So, patients in terminal neuralgia they avoid touching their face because, as I mentioned, even simply touching the face can trigger the episodes of pain. Where in other facial pains, people they massage or rub the affected area. But when somebody says I have pain and when I rub this area or massage, I get relief, that can't be terminal neuralgia. In neuralgia, they don't touch the face. And then patients hold their head still while talking because when they talk and head moves the pain can be there. So when somebody is holding the head like this and then talking, then it's a terminal neuralgia. Another common thing which can be confusing with the terminal neuralgia is migraine. So in migraine attacks can happen during sleep also, but in terminal neuralgia the patients usually have attacks when they're awake. When they're asleep, episodes of pain usually do not occur. So how do we finally confirm the diagnosis? So there is no confirmatory test, no blood test, no scans can be are required usually. So when I discuss the symptoms, when a patient has unilateral facial pain, which gets triggered with various activities like brushing teeth, eating, chewing, swallowing, or even breeze of air, and pain lasting for a few seconds up to 2 minutes, then we are dealing with terminal neuralgia. In some cases, brain scanning like MRI may be required to demonstrate neurovascular conflict, where the terminal nerve, as it starts from the pons, it gets compressed by a blood vessel. So that can be demonstrated. And rarely, tumors and cysts can also be found. But these are not common conditions. In most cases, we don't find any usual cause for this terminal neuralgia. And how do we manage this condition? So the first line of treatment is medical treatment, and the drugs of choice are carbamazepine or oxcarbazepine. And with these two medicines, most people get relief. And when in doubt, when we start these tablets and patients feel better, we know that we are dealing with terminal neuralgia. If these medicines can't be used due to allergic reactions or sometimes hyponatremia in some people, then other options are lamotrigine, baclofen, and gabapentin. So these are the, with medical treatment, almost two-thirds of patients get good relief, and minor side effects like dizziness can occur, but usually they are safe medicines and can be continued for long. But those who don't respond, we have a few options. One is Botox injection, can be given in subcutaneous intradermally, where patients can localize the pain. It is not FDA approved, but many patients do get relief. And those refractory cases that do not respond to medical treatment, there are two options. One is radiofrequency ablation and microvascular decompression surgery. So these may be required in about 10 to 20% of cases where pain is severe and not responding to medical treatment. So I think, with this short presentation, I hope that you had, good experience of knowing about signs and symptoms of trigeminal neuralgia, and how we can diagnose this condition and what are the various modes of treatment. I'll be happy, if you have any comments or queries related to this topic, please post in the comment section, and I'll be happy to answer all of them. Thank you till I get back with the next video. Have a good day.